So I just want to spend a couple of minutes here, a moment just to tell you guys it is really important that when a patient see a physician, especially for the first time, it is very important that the connection or the rapport between the physician and the patient need to be established. So it is hard to get trust immediately because you are meeting a stranger. You don't know who this doctor is. The doctor doesn't know who you are. There's a lot of suspicions. There's a lot of reservation in between the encounter. So it's very important for the physician to recognize that, try to break the ice, and try to establish the rapport. However, there are many times, although it's rare, but it can happen quite commonly, that it is very difficult to connect with the patient when the patient has a significant amount of barrier, significant amount of resistance towards the physician, and sometimes even animosity, and that translates into mistrust. If the patient comes and you are unable to establish a rapport, and that patient can become sometimes aggressive, sometimes very suspicious, sometimes downright nasty, then it makes the job of a physician extremely difficult. It is very difficult to provide care for a patient when that patient doesn't trust you, when that patient is resisting and frankly doesn't take your word for it. And it always baffles me. I don't know why people go see their doctors if they have this kind of attitude. And I gotta tell you, it's a secret among the doctors, okay? In general, nasty, aggressive patients don't get the best care from their doctors. You know what I get? They get the defensive medicine care. So we often do the bare minimum, just legal, okay? Make sure it's legal. We document the crap out of the chart, okay? And that basically CYA. And you would not put your heart in the care of this patient. You would not treat this patient as if this patient is your own family and your own friend. If you're unable to connect with this patient, and if this patient is downright aggressive towards you. So it is important for a patient to know this. A lot of you guys don't know this. But when you go see your doctor, your nurse, it's important to establish that rapport. It's important to get that connection. Because we are humans. We do treat nice, polite people very different than we treat people who are aggressive, displays animosity and mistrust in the providers or the doctors. I hate the term providers because it's grossly inaccurate. Clinicians is the correct term. So it is something to keep in mind that the connection between the patient and the physician is important. That establishment of relationship is the foundation for many, many visits to come. And you like it or not, the first person you're going to see the moment you're born is a doctor. And many, many times, the last person you're going to see before you die is a doctor. And of course, many, many times in between. So this job gives me a privilege and an honor to be at the bedside with the patients. But it's sad that a lot of people don't know that dynamics in encountering a physician for the first time or the subsequent times. So just a little bedside chat, and I hope you guys have a wonderful evening, and be careful.